Lesion removal. So here's a table to help a coder remember the steps they need to take and how to code that excised lesion. Is it benign or malignant? Where is the anatomic area? The excised diameter, how big is that lesion? And that should be documented by the physician. The type of closure, is it single? Which is a single, is it simple, excuse me, is it simple, which is a single layer? Is it intermediate, which would be a layered closure? Is it complex, which would be more than a layered closure? Are they doing a graft? All that would depend on the documentation, and if it's a simple layered closure, that is included in the excision code. But if it's intermediate or complex, is coded, that can be coded separately. So determining the lesion size. Size is very important when reporting a lesion excision. Code selection is determined by measuring the greatest clinical diameter of the lesion plus the margin required for complete excision. The physician should measure the lesion plus the margin before that excision and have that documented in the medical record. Do not select codes based on the size of the incision and or that resulting surgical wound. The physician needs to document that. Also, size should not be used or taken from the pathology report for the diameter, as when specimens are placed in formaldehyde solution that is used, it can reserve the specimen, which can result in that specimen shrinking. So here's an example. The excision diameter equals the length of the lesion at its longest point plus 2 times the narrowest margin. So a lesion measures 1 centimeter at its greatest. The margins removed are 0.5 centimeters on all sides. So our total excised diameter is 2 centimeters, and we get that by 1 centimeter for our greatest, plus times 2 the margins, which times 2, that would be 1 centimeter. So 1 plus 2 times 0.5 equals the 2 centimeters. So what's the difference between all this? Excision. Excision is full thickness through the dermis, removal of a lesion including margins. They can be performed by a scalpel involving cutting into the subcutaneous tissue. Shaving, sharp removal by transverse incision, a horizontal slicing. Paring or cutting, removal of superficial tissue using a spoon-shaped surgical instrument called a curette. This procedure is also called a curettement. Lesion destruction occurs via laser surgery, electrosurgery, any other kind of methods, but it's not used by a scalpel. Repair of superficial wounds. A simple repair is included again in the excision code for lesions. So example, physician excises a 5 centimeter benign lesion of the skin on the left thigh with simple closure. Coder's only going to report that excision code of 11400. Repair of intermediate wound. Intermediate repair is a layered closure of the deepest layers of the subcutaneous tissue and non-muscle fascia, in addition to the epidermal or dermal layers. And you'll see it documented as either intermediate repair or a layered repair. Physician excises a benign 2 centimeter lesion from the ear, then closes the wound with a 4 centimeter intermediate repair. Coder's going to have 2 codes, one for the excision, 11442, and one for the immediate repair, 12052. Now, repair of complex wounds. They're more than one layered closure. They're like scar revisions, deep removal of benign or malignant lesions, extensive undermining. Code is not often used, and it should be documented as a complex repair by the physician. So in this example, the physician excises a benign 3.0 lesion from the upper back, and they performed an extensive undermining complex repair. They're going to have 2 codes, 11403 for the excision of the benign lesion, and then 13101 for that complex repair that was 5 centimeters.